package is designed to give us an awareness of what dementia is and to give us some strategies on how to deal with those with dementia. I recall in my first placement as a nursing student when I was placed in a aged care facility, and I came into contact with those with dementia, and I wasn't really sure how to treat these people or how to care for these people. I felt a bit overwhelmed because, in my opinion, they displayed such bizarre behaviour, and I didn't really understand what dementia was or how to actually care for someone in a way which was individual, which was person-centred. So this is what this awareness package is all about, to teach us what dementia is, to give us strategies in learning how to help those suffering from dementia. Dementia is not a particular disease, but it's actually an umbrella term which covers a whole variety of diseases. These certain diseases affect the workings of the brain, and the symptoms of dementia include memory loss, reduced cognitive ability, mood swings, depression, disorientation, and lack of physical coordination. Dementia interferes with a person's normal activities of daily living. Now, the challenges with those with dementia they can lose the ability to speak, they can have behavioural changes, that is, there is a decline in cognitive function, which can have an effect upon exhibit their emotions, how they interact with other people, and of course their motivation. Alzheimer's is the most common type of dementia, and between 50 to 70% of most cases are those who suffer from Alzheimer's, those who have dementia. Alzheimer's has to do with the loss of the nerve cells within the brain. Now, as a result of what they call neurofibrillary tangles and amyloid plaques, these build up and they affect the actual ability of the nerves to send messages and to function properly. Now, the first areas which are affected in the parts of the brain is those areas which are used for the memory and cognition, and we'll talk about that in a little minute. Important to note that there is no cure for Alzheimer's disease. Medication is used to slow the progression of the disease. When we have a look at a cross-section between a normal brain and someone suffering from Alzheimer's disease, great variation in the physiological changes. There's actually a decrease in the actual brain size to the right-hand side of the screen. Now we can see that those areas which are affected the most is to do with the memory and the language. It is important to have some sort of understanding of the physiological changes that are occurring within the brain for those who suffer from Alzheimer's disease. And the brain's been described like an onion with many layers, and as we grow, the layers accumulate of memory. But with dementia, those layers are peeled off until finally the memory is gone, the language is affected as well. And it's the short-term memory which is affected, which is why people with dementia cannot remember 5 minutes ago what happened. It's not their fault. And they might have difficulty in articulating to you what their problem is, what their particular problem is. And so they might get frustrated. It's important to understand these things when we're actually caring for someone who has dementia. So what can we do? How can we assist those we are caring for with dementia? What strategies can we employ? How do we approach this? Person-centered approach is all about emphasizing the client as an individual who has various needs and various abilities. It's about being flexible in the delivery of your care. It's about tailoring your approach for that particular individual. It's a way of thinking. It's a way how we approach things. It's an attitude. It's not about performing a particular task. It's about how we approach that particular individual. We need to understand the person. We need to find out about that person and treat them as an individual. So there's some important things we should be doing. We should read the person's notes. We should talk to the person. Ask about their history. We should speak to their family members, find out more about that individual, listen to their life experience, see them as a person who has experienced a whole wealth of things. Find out about their likes and their dislikes. Acknowledge that they have needs and that they have feelings. Don't isolate them, don't ignore them. Don't see them as not being able to participate in any meaningful activities. The person-centered approach is about seeing the person as an individual and not just as a patient who needs to have a shower, needs to be washed, or needs to be changed. So one of the most important things we can take away from this is to actively listen to the needs of the person we're caring for. As we said before, it's important to understand the physiological changes that occur within the brain during the dementia process. Now, as we said before, damage to the area of the brain which has to do with remembering and short-term memory is usually affected first. This is the area called the hippocampus, shown in the picture here. One of the very last areas to be affected, usually in the late-term dementia, is called the amygdala. Now, the amygdala plays a key role in the processing of emotions. So whilst we might think that the person, if they have a negative experience, will forget it in about 5 minutes, however, those emotional memories are laid down and they will feel the same way if they're placed in a similar circumstance. It's important to understand that, because if we're going to care for these people, we want to deliver care in a way that is not threatening, in a way that is calm. We just speak to these people. We can speak to those with dementia in a calm voice, in a way that is mindful of their emotions. As we mentioned before, people with dementia might not be able to articulate how they're feeling, but they are sensitive to emotion, and so they can pick up on how we are feeling. Are we rushing around with a frown on our face, determined to get our task done for that morning? If we are, we should stop and think about how we're projecting our emotions, because quite often those with dementia will reciprocate that same emotion. We should stop what we're doing, put a smile on our face and go about our work in a calm and open, non-threatening way. And hopefully that smile will be reciprocated in the ones we're caring for.